it's Dr. Rick. I'm going to do a rapid test using this FlowFlex. I just picked this up at CVS for 11 bucks, and the prices are going down, but we should get 4 free COVID test kits per household. I don't know how long that will last, and I don't know if that will be easy, but we'll see. That's a nice offering. However, I'm going to work today, and I have to make sure that an exposure that I had is still keeping me negative. I do have antibodies, and I'm going to be talking about that in an upcoming video. I just did a video on rapid versus PCR versus antibody testing for serology, so I'll put a link down below. But if you are using a rapid, or you can't find a rapid for several days because it's not available, maybe you can go to your local pharmacy. This is what the box looks like. It comes with this, which is your lateral flow plastic container. There's a little well where you put the fluid, and this is your read. Nice instructions on what to do. Now I kind of know what to do already, but please read through. Stamp of official something or other. Another set of instructions. And here is the fluid. Here's the swab, and it's short because I don't want to poke my brain. So open the sterile swab. You can insert it 1 to 1.5 inches into each nostril. So you put it in, you swirl it, you rotate it, but you also paint the inside lining of the nose. Oh, it's so sensitive, but try not to sneeze. All right, so I've gotten enough of the inside lining because that's where the virus might sit. Ooh, and then you rotate again. Okay, take this, take your fluid. It has to be at least 5 seconds of putting this in your fluid, and you swirl it in the developer, just like that. 1, 2, 3, 4, 5. It gives it enough time to react, and I like to squeeze all the fluid out of the cotton or rayon, whatever it is. Put the cap on. That's a nipple, actually. You put a couple of drops in here in the well. I can't really show you because I got to see where it's going. Now you want to wait for that to develop. So you have to wait 15 minutes for the official stripe. A stripe at the C or control is okay. For any stripe in addition at the T or test is a positive test. Now you have to remember how to interpret this. As if you watch my video on rapid versus PCR versus antibodies, you can shed viral pieces, whether it's the protein for the rapid or the DNA for the PCR. You can shed virus particles even without being infective or contagious. So if you have a high amount and the virus has essentially been killed because it has no place to go, or the spike proteins have been neutralized by the vaccine, or the virus has been obliterated by your T cells or B cells, and the virus is destroyed, but it's still going to be there, the dead particles. So you can, especially with a very sensitive test like the PCR or a rapid, you can still pick up a positive test. So the question is, if you're positive on testing and you have symptoms, are you shedding in an effective way or contagious way? And nobody really knows. Even with antibodies, even if you have antibodies, it's not exactly translated to say that you're immune or you're contagious. So it all comes down to clinical acumen or symptoms and the decision-making process. And that's why there are guidelines set forth by the CDC up high, but it still comes down to the decision-making process by your doctor and your physician team. So if there's tests that are done, if there's an ER doctor, a lung doctor, a kidney doctor, we all work as a team to figure out, okay, are we contagious or are we past that and convalescing and just with symptoms of a cough or weakness or brain fog or body aches or fatigue? And it's very difficult, but I do have patients in my COVID clinic who have a lot of those symptoms, but they're testing out negative. So in that case, I'd say they're non-contagious, but symptomatic, long hauler. I have a few patients that are with those same symptoms, but also with a positive test. And for them, I have to conclude that, especially if they are staying with old people or folks that are immunocompromised or little babies, I have to say that they might be contagious. So I choose to take the higher road and say, please don't spread it. Just pretend that you're contagious and act that way, at least until all symptoms go away. Now, if all symptoms go away, specifically what the CDC says is no fevers, off of Tylenol, then it can be argued that you're probably not contagious. Again, it's case by case. The protocols are to give you guidance, but if you're not sure, because it's very confusing, that's when you get to a professional to help you decide. So it's not just you and your house and going out and going shopping. It's you and the other employees at work. It's you and your kids. It's you spreading it to your kids and your kids spreading it to you or the rest of the community. There's a trickle-down effect that we have to take into consideration. So we first take care of the person in the room, then we take care of the family and the person in the room, then we take care of the town and the family and the person in the room, and then we take care of us, because we don't certainly want to get sick either. Otherwise, it takes the medical professionals out of the picture, and then you wind up with no medical professionals. That's chaos. So it's been 15 minutes. This one single red line is negative. I will probably be that way for a long time. My antibodies, regardless of, there's no exact normal for a range yet, but I do have antibodies to the spike. And I had some blood tests done today for nucleocapsid, IgA, IgG, IgM. I'll be doing a video on that soon. So I can go to work and I still want to mask up. I don't have any symptoms, but I was exposed. And unfortunately, I'm a physician. I'll be exposed every time I go to the office. So that's the risk I take, but that's the Hippocratic Oath. I have to take care of myself and my family, but I have to help others. Hope this gives you guys a couple of ideas of what to use, and if you do get this, that's fine. As far as the sensitivity and specificity of these things, initially there was a listing of the sensitivity and specificity for these companies putting out their requests to be approved by the FDA under the EUA. I really can't find, there's like 36 that have been somewhat passed by the FDA, but I cannot find the sensitivity or specificity specs. So we'll have to trust that they're good, I guess. But if you're in question, you really should be getting a PCR. The PCR is the most sensitive test, and that'll give you a better estimate. There is a PCR you can get that you can mail away, but it takes forever to get it, like 8 days. And part of the process of having test kits available for everybody is to shelter and stop the spread. Again, it's that concept of protecting you and the community and your family. So hope this gives you a couple of ideas. If this is your first time watching, consider subscribing to the channel. It helps the algorithm if you put a comment or if you share this with others. So stay safe. Even if we get over the hump, this will be an endemic disease. So if the plateau is occurring now, like it has in South Africa and UK, then it's going to be going down. But we'll have to keep an eye on what happens in South Africa as we go into spring and they go into winter, because if it blossoms there again, which I think it will, like usually influenza does, it's going to come back to us in the fall. So we're not exactly out of it. I think we are going to be out of the pandemic and into an endemic disease state. So if you haven't made up your mind to get rid of your comorbid conditions, do it now, because we're going to go through this thing again, not in a pandemic effect, but more of do you want to prove your immunity or do you want to get a vaccine? I think it's going to come down to that. And if you do get sick, there are going to be a lot of other medicines that are out there that are available, and you can stack these things all to your benefit, whether it's Paxlovid or Molnupiravir, I'm not confident with, fluvoxamine, ivermectin, vitamin protocols, monoclonal antibodies. There's a lot of things that are coming down the pike, but it's up to you to get rid of your comorbid conditions so you can fly through this. I'll talk to you at the next video.